So, hello everyone. My name is Trevor Hassel, and it is my pleasure in my capacity as President of the Healthy Caribbean Coalition to welcome everyone to this, the third in a series of HCC-led webinars on the development of alcohol policy in the Caribbean. Today's webinar is in fact being conducted in association with the Caribbean Institute and Other Drug Problems, or CARIAD, and it's been made possible with the assistance and the support of several partners, including the NCD Alliance and the Department of Health of the United Kingdom. Today we are especially pleased to have Dr. Maristela Monteiro, who is Senior Advisor Alcohol and Substance Abuse at PAHO WHO in Washington, D.C. Dr. Monteiro, as I said, is a Senior Advisor on Alcohol and Substance Abuse at PAHO WHO. And she is a medical doctor with a PhD in Psychopharmacology from the Federal University of Sao Paulo in Brazil. Dr. Monteiro is currently responsible for alcohol policy, alcohol research, and capacity building activities related to alcohol, including the implementation of the Regional Plan of Action on reducing harmful use of alcohol. Dr. Monteiro is well published. She's in fact the author of over 140 publications in scientific journals and book chapters. So as you can see, Dr. Monteiro is really a leader in championing the need for appropriate alcohol policies in Latin America and the Caribbean. It is therefore with tremendous pleasure that I now invite Dr. Maristela Monteiro to speak to us on the conflicts of interest related to alcohol policy. What can be done? Dr. Monteiro.
All right. Good morning, everyone. Thank you, Trevor, for the nice presentation. And I hope we can have a meaningful discussion, as I think, first of all, we share a common concern over alcohol consumption and in the region, in the whole region, and you in the Caribbean region. So there is a big challenge ahead of us at the regional office, in technical cooperation, in governments, and also those in civil society in implementing effective alcohol policies. So we need to talk about who and what is the alcohol industry first, to then analyze the issue of conflicts of interest and why this is a conflict of interest when we're talking about alcohol policy. First of all, over the last 20, 30 years, globalization of the industry has occurred, and with that has the availability of alcohol. And while we have markets in developed countries like in Europe, Australia, US, Canada, that are considered more saturated, meaning that many people already drink, the movement of the alcohol industry in this globalization is to reach new markets and new population within any market that is not yet drinking or can increase its drinking, because that's the way they will sell more and have more revenues. So it's a basic fact that an industry is that is legal, it's there to make profits. That is valid for any industry nowadays. And to sell, it is necessary to market your product. And therefore, as a result in this availability and reaching out to countries all over the world has come with an increase in marketing, and marketing in a globalized world becomes a very sophisticated technique that allow for different cultures and different people, sectors all over the world to have the same feel about alcohol. And we have seen that happening with very basic approaches that are behind the marketing strategies. Is one that is alcohol is positive, it's good for your health, it's necessary for living, it is part of of everyone's culture, everyone drinks. So to be a non-drinker, it's being odd, and this has been indirectly a message that you're not cool, especially with young people, if you don't drink, and more recently, if you don't drink enough, or you fall out or you pass out. Women and those young people are a particular target, just because they're used not to be consumers, and they can become, and right now. And this also, women in particular have been the target, given the movement of equity that is a good movement of women having the same rights as men, same access to job, education, and position in society. And this has been taken by marketers to say they also should do like men and drink as much. And therefore they've been specifically targeted with messages about how cool and part of being a cultured and equal to men to drink as much. And unregulated marketing also allows women to be portrayed as sexual symbols and objects to be conquered. And this is when you do marketing to men, so they associate with pushing men to drink even more. And what is this? On the other hand, what we hear often from the alcohol industry is that they don't want people underage to be drinking. They don't want excessive drinking. Of course, they don't want alcoholism. And therefore, they look like having public health goals. But when you analyze the revenue of the alcohol industry, almost 50% of it, or 40% in some markets, and where this has been analyzed, comes from selling alcohol to underage drinkers or those who drink excessively. So to believe that an industry is interested in reducing 50% of its revenues is at least a joke. No CEO would remain in their position if they announce that. So therefore, what they want is a wish that everyone in society wants. Of course, they don't want kids to be drinking. They don't want alcoholics in the world. But as part of their profit is to sell to those groups. Here, again, I just don't want to spend too much time on this slide. If it becomes available, you can verify. But I did a very first grade math, almost simplified math, thinking of a community of 1,000 people, adults, in any given drinking day, based on what we know or believe to know about drinking. Most people do not drink excessively. So as you can see there, in that population, 70% is in that range, and 25 2.5% would be drinking excessively, and another 5% would be alcohol drinkers, dependent on drinking, alcoholics. So if you believe in that same proposal of the industry to reduce, everyone should be drinking at most 2 beers a day, and that would include alcoholics, which is not recommended or, based on any evidence, but even if you did that, you would reduce significantly the sales of alcohol. If you only treated the alcoholics, you don't reduce that much, and this is why it's very positive to promote that alcoholism should not exist, because most of the drinking in a population does not come from people who are dependent on alcohol. And if you only took care of the heavy drinkers, is proportionally the sector of the population that you would reduce the most the drinking. So again, the alcohol industry is not going to promote that or support that necessarily with effective measures. So a population approach that everybody may reduce a little bit their drinking through fiscal policies, for example, or limits on underage drinking and where you can drink and at what times, places, etc., where you can buy alcohol, is the most cost-effective measures that in theory affects the whole population, but actually in practice you are affecting mostly those who drink the most. They are going to fill in their pockets more, even the alcoholics. It's not treatment for alcoholism, but it is an effective policy for that group as well. We'll get there. The unregulated marketing that we have in almost every country is a problem and portrays, as I was saying, negative views of women. Here, for example, also promotes heavy drinking. It is a beer from Honduras, and in the label on the back, you can peel off and apply and receive awards of all types, TV, travel around the world, plasma TV, computers, you name it. And we also have self-regulatory codes imposed and agreed upon by the industry. This is one example. Discuss is the Distillers Council of the U.S., and participants agreed on these self-regulation codes. And there is no enforcement, there is no binding anything, no penalty. It is an agreement of the industry itself, and this is one of the regulations they have. The marketing and advertising of alcohol should not include or imply excessive sexual activity or indecent images or with sexual connotation. And the same producers are the ones with these ads. So what you learn from that is about self-regulation is self-explanatory. So what are the corporate practices that influence harmful drinking? First is the product design. So there are new products in the market that actually have more alcohol than before. Strong beers is an example, or ice drinks, alcohol pops. The packaging that make it easier to consume anywhere or to hide the consumption, especially for young people. So in plastic containers, easy to disguise. Also the taste of it, the fact that you use a lot of sugar, you don't feel the alcohol, and you can drink more, or it's easier to develop a taste and tolerance, and then with time increase consumption. The marketing also looking for new markets, but also strategizing and focusing specifically on every single subgroup. In the U.S., there's plenty of information and research on that, on their markets for African Americans, for particularly poor people, for indigenous people, for women, for young people, etc. And certain beverages are that follow their taste are marketed more intensively to them. The wide distribution, the better networks, supplying to bars and upgrading bars so they can sell more, low prices and discounts, not only in bulk but also in the restaurant industry, bars, and the political influence that is to prevent other policies to be implemented. So here, just an idea of how globalized we are, and the 26 largest companies have a profit of $26 billion a year. It is in 2005, very concentrated, especially beer and spirits. Here is a more detailed example of some countries. I don't have information on the Caribbean, but that would be very interesting to know for the Caribbean countries who are the big players for beer and for distilled spirits. And now moving, so this is an overview of the industry, and here is what are the mandates of the WHO. In over the years, several resolutions in the World Health Assembly have dealt with economic operators or the industry, but they have been misrepresented by the alcohol industry itself. So the resolution on public health problems says that there will be open consultations with the industry and other sectors in order to limit the health impact of harmful alcohol consumption. This have been happening over the years, but a consultation is not a collaboration. It is a dialogue to hear what they have to say. We say what we have to say, and there is no agreement at the end necessarily on anything. We hear each other, we share some information, there is no discussion on any policy or any collaboration. And 3 years later, after this resolution on the strategies that were developed and approved to reduce the harmful use of alcohol, the Director General also consulted with them on how they could contribute to reducing harmful use of alcohol. And when the global strategy was adopted in 2010, there are 2 paragraphs that are important in that strategy. One is in paragraph 48. It says the Secretariat says anyone working for WHO will provide support to member states in continue its dialogue with the private sector on how they can best contribute to reducing problems. Appropriate consideration will be given to the commercial interests involved in their possible conflict with public health objectives. So here again, it is a dialogue, and engaging in any collaboration, it will be considered the conflicts of interest there implied, and whether the organization will or not benefit from their interaction. And paragraph 45 says economic operators in alcohol production and trade are important players in their role as developers, producers, distributors, marketers, and sellers of alcoholic beverages. So again, here, this is important because the alcohol industry and people related to that industry have a specific role. They are producers of a legal substance. They distribute it, they market it, but they do not
do research, they do not do education, they don't have the role in promoting policy, and this is very important. That's exactly where they want to be involved, and they have been proposing prevention programs, other educational programs, or training people on drink driving measures, but this is not their role as stated in the global strategy. What was mostly request of them is, can you provide us the data on sales? And this has been happening because WHO needs that data to come up with estimates of alcohol per capita consumption. That data would not be necessary if member states, if the government could have access to that data. And every government probably does have. Not the Ministry of Health, not health authorities necessarily, but the finance departments need to have that information, because everywhere there is some taxes on alcohol, and therefore they know how much alcohol is being sold, imported, exported, and that information would be precious for health to calculate on their own the per capita consumption. So the nature of the interaction is not a collaboration, it's not a partnership, it's a dialogue. It's consultations there between WHO and the industry. They're very well planned. There are agreements signed on how that information of that interaction can be shared or not shared, but never the industry has been engaged directly in the process of the alcohol policy or strategy development. And on several occasions, the Director General has been very clear about that. There have been other recent developments in relation to non-communicable diseases and in relation to a broader issue, which is the interaction of WHO and member states with non-state actors. This is a broader term that includes not only the alcohol industry, any industry, but also NGOs, professional organizations, other private foundations, etc. And this is still ongoing, the discussions on how each should be interacting and participating in the process. So the alcohol industry, as a result, especially of the political declaration on NCDs and global and regional action plans, has been increasing its efforts to be part of that. They, for example, had before different think tanks or groups that were lobbying with WHO. They now integrated and formed the International Alliance for Responsible Drinking, IARD. You may hear people saying that they represent them, and this is basically the alcohol industry. Very strong is ICAP, also merged into IARD, is the International Center for Alcohol Policies. There are in beers, Cerveceros Latinoamericanos is a very strong group in the whole of Latin America. Ambev is also beer, is in Brazil, but now it's global, it's Ambev, InBev, and corporate social responsibility groups everywhere also relate to, they represent the alcohol industry basically. So the industry have come up with 5 commitments, as they say. And everywhere, if you begin to look at what are these corporate social responsibility programs, what they're doing, they are pretty much in these 5 areas. So they are trying to do the same thing everywhere. Reducing underage drinking, strengthening or expanding marketing codes of practice, all self-regulation, providing consumer information and responsible product innovation, reducing drinking and driving, and enlisting the support of retailers to reduce harmful drinking. And there is a site that lists over, thousands of initiatives of the industry, and its analysis already done of those initiatives have basically concluded that they're not doing anything. They're just listing minor activities. Sometimes there are big activities, but although they seem to be in line with the global alcohol strategy, they are unlikely to reduce any harm. Underage drinking is a wish, but there is a problem of enforcement. They work with bars to reduce the sales to kids, but at the same time they promote the bar, and so drinking or sales increase for adults, and adults go back to their homes where their kids will receive the same type of norm and might be victims of violence due to intoxication. The marketing codes, there are several studies that show that they do not work at all. Providing consumer information, this has been an area of much expansion and a lot of national activity, but the information usually is favoring their products and only their health benefits. They're usually highly unscientific or not, or a small study or basic research and things like that. Innovation in products, in general, it has been to more harmful products because they will reach more young people, more women, or etc. And drink driving, they have been providing in some countries alcohol tests, the means of doing the breath analyzer or by the road, but there are no laws in the country. They may have laws, but they don't have the police available to do, and to provide just the equipment doesn't do any good. And the drink driving so far is poorly enforced pretty much in any country in our region. So the WHO position then has been, as I said before, on a few occasions the Director General was very upfront about it. So there is a letter that was sent to the British Medical Journal in response to a letter of the alcohol industry. And also she spoke at the Global Alcohol Policy Symposium that was organized in Turkey with hundreds of people and co-sponsored by WHO, and the 8th Conference on Health Promotion in Helsinki. And in all these places, the same thing, the same message has been given, that the development of alcohol policies is the sole prerogative of national authorities, and the alcohol industry has no role in the formulation of alcohol policies, which must be protected from distortion by commercial or vested interests. So again, it's very clear the conflict of interest, and that governments have a primary responsibility for formulating, implementing, monitoring, evaluating public policies, not the industry. Training, research cannot be given or sponsored by the alcohol industry because of the conflicts of interest. So to finalize, I wanted to give the guidelines of PAHO on collaboration with private enterprises. I believe this is the only region that has a clear policy on interaction with the alcohol industry. It were approved by the director and presented at the 46th Directing Council. This was 2003. Was broadly defining what are private enterprises. So it's not only related to tobacco, but any private business. And it was aimed at facilitating the engagement, when appropriate, with private enterprises in an effective manner. So the general principles of these guidelines are, first, we are a public international organization. We have a health mandate, and whatever we do need to achieve a positive outcome in health. And we need to engage in alliances and to promote the priority established by its member states. The conflict of interest in the guidelines is a primary consideration in evaluating any collaborative relationship to avoid or mitigate real or perceived conflicts. Sometimes there is not a real conflict, but people outside the organization not involved may perceive that as a conflict, and this can damage the image of the organization as well. And this could be principles applicable to other interactions at national, subnational level. And the mere appearance of impropriety, as I said, can be harmful in this case. It's necessary to do due diligence and a risk analysis before any engagement is done. So any proposal that comes to PAHO needs to be reviewed and assessed whether the organization might be at harm or may be potentially harmed by engaging in that, whether there is a positive result for health, and balancing both sides, a decision that is towards the positive, of course. So their due diligence would imply there is some compatibility of missions and goals, the products and services, the behavior, the public image must also be examined here. Good corporate citizenship, parent or related companies are also looked at, and the source of funding for any collaboration needs to be disclosed. Sometimes comes an industry itself, and it's easier to decide on that. Sometimes comes a group that we need to ask where are their fundings, source of funding. And it's very clear in the guidelines that PAHO does not collaborate with tobacco, alcohol, weapons, and landmines at all. It's stated like that because the conflicts of interest are so high that preclude any collaboration. So other companies that will have products that are detrimental to public health and can cause severe environmental damage also would be prevented from collaborating directly or indirectly with PAHO. Other entities that can cause a reputational damage to the organization, and anonymous donations are not accepted because we cannot disclose who is behind it. The risk assessment means that for one activity may not happen, it may not have a big risk, but that doesn't mean that for other activities it won't be. So we need to have a broader view, and sometimes one other program of the organization engages with an industry that's, let's say, tobacco industry. There were attempts of the tobacco industry to finance vaccinations. They could pay for it. And it's important to know when to say no and link those collaborations across several programs in the risk assessment. So for some collaborations, direct financial interests, when they exist, the funds are not accepted. When there are indirect interests, that's more cautionary. It will depend on a case by case, and so therefore to be more detailed in how we deal with different private enterprises is very hard, because
each case may and needs to be assessed. Of course, no engagement with any private sector means an endorsement of their product. This needs to be clear. The commercial activity also cannot use the PAHO logo in any way. So these are among the details of the assessment done here. Transparency, it's very important to have in any relationship with a private enterprise. So things need to be traced back to its origin, you know, and reports made available, use of the funds, acknowledging all the contributions, and means not providing more than it's necessary. Whatever we engage with, we need to have a leadership role as well. And for example, the logo of PAHO cannot be smaller than someone else's logos. And we need to be able to defend whatever collaboration we decide to engage with. Just to finalize, and we can open for the rest of the webinar, is that we have several virtual courses available, and in relation to alcohol, there's one on alcohol and public health, alcohol policy and public health, and it's based on the very acclaimed book, Alcohol No Ordinary Commodity. This course is available for free. It's for self-learning in the virtual campus of PAHO, and it's in English and in Spanish. And WHO has developed e-portals that have all, in every language, containing the same information. It has information to the public, for health professionals, even a brief intervention for alcohol problems if someone decides to do their own assessment, totally confidential about their current drinking. That's possible. So you can look in India was the place where they implemented the English version. We have in Portuguese for Brazil, we have in Spanish, and it also exists in Russian. With that, I think I'm finished. Thank you very much.